Welcome, parents. Hello, everybody. I'm excited that you're here. We're going to be talking about oppositional defiant disorder in our kids, signs of this disorder, and what you can do as a parent. Hello, my name is Kristina Campos. I'm founder of The Impactful Parent, and every week I come on and answer one of your questions live. And if you have a question for me for next week, please submit it at theimpactfulparent@gmail.com, or you can message me on social media. All submissions are kept anonymous, and it's free to do it. So go ahead, ask me a question. Now, today's question from the audience is asking to understand oppositional defiant disorder better so that this parent and you can identify the symptoms and decide if their child needs to seek help. I love this question. Thank you so much for submitting it. Today, I'm going to tell you the signs of oppositional defiant disorder, and stick around to the end because I'm going to give you 10 tips for helping your child so that you can be a more impactful parent. So let's get started. Now, oppositional defiant disorder, or ODD, is when a child displays a continuing pattern of uncooperative, defiant, and hostile behavior towards people in authority. This could be anyone in authority, and it doesn't always have to be a battle against the parents. So, what makes oppositional defiant disorder different than, let's say, a child that seems to be argumentative or doesn't want to follow the rules? Well, for children to be diagnosed with ODD, they need to have most of the following symptoms that I'm going to list, and for more than 6 months. Now, a lot of children will go through a phase of rebellion, but children with ODD will refuse authority figures way beyond the length of just a phase. Okay. So, what does that look like? It will feel like the littlest thing might set that child off. The ODD child has to win all the arguments, and they won't give up. They won't give in to boundaries. They won't give in to rules or someone trying to control them. They won't have that. Children with oppositional defiant disorder have frequent temper tantrums. Children with oppositional defiant disorder will argue with adults intentionally. It may feel like they're just like picking a fight, and they will refuse to do what adults ask. Children with ODD can be very challenging because they will always question the rules and refuse to follow any rules they don't perceive to them is going to serve them. So if it's not in their best interest, they don't want to follow them. Kids with ODD typically won't hesitate to speak harshly to their parents, to teachers, to police officers, really anybody in authority. And these kids are also annoyed with adults in authority often and will openly look angry and resentful toward any adult authority figure. Now, two of the most obvious qualities differentiating a typical rebellious child against a child with oppositional defiant disorder is that children with ODD will be vindictive. They'll be downright spiteful. They'll do things to annoy or upset others on purpose and blame others for their own misbehaviors or mistakes. Children with ODD don't typically take responsibility for their actions, even when the blame is obvious. Now, causes of oppositional defiant disorder are unknown. Sometimes it could come from an onset of a head injury or developmental factors. Other times, doctors say it could be genetic, developmental, or even learned. ODD is associated with absent or neglectful parenting, but children with loving and present parents can also develop this condition. So that doesn't help much either. Either way, the exact reasons why anyone has ODD are actually unknown. And to make things more difficult, oppositional defiant disorder often is co-occurring with other disorders, such as ADHD, depression, anxiety, bipolar disorder, conduct disorder, and other learning disorders. It is also a misconception that oppositional defiant disorder develops only in adolescence. No, this isn't true. ODD occurs at all ages of development and in adults. 10.2% of all children develop ODD, and usually it's diagnosed at around age 8. Now, problems that come with ODD are usually poor school performance because, well, they're going to have trouble in school, antisocial behavior because they're not socializing well, substance abuse, trouble building relationships, poor impulse control, and even suicide. So parents need to educate themselves and get their children help with such detrimental repercussions. And ODD, it's treatable. More than 65% of children with ODD see their symptoms go away in 3 years or less when they get help. So, what can parents do? If you're listening to this, it's resonating with you, and you think, ooh, my child might have ODD, I'm going to give you 10 tips for what you could be doing right now as a parent. Tip number 1, first of all, do not punish behaviors associated with ODD. I know that sounds counterintuitive, but it actually doesn't help. In fact, harsh discipline is a risk factor for developing the condition and can even make the child's condition worsen. So obviously, this makes disciplining and parenting a challenge. I get it, but you do not want to punish it harshly. Tip number 2, instead, take the child to a mental health professional. Once your child is officially diagnosed with oppositional defiant disorder, your doctor will encourage you to go to a therapist. Now, the therapist will likely suggest various types of help. Some may suggest parent-child interaction therapy. Others will recommend individual or family therapy. Some therapists may suggest parent training, social skills training for the child, or problem-solving training for the parent and the child or the whole family. Either way, go to your mental health professional and get some help. Tip number 3 for helping children with oppositional defiant disorder is praise positive behaviors. You want to give rewards for behaviors that you want to see again. Focus on the good behaviors that you see your child doing. Your child needs praise and recognition for things that they do well. Even if you're praising them for a task that you feel any child should be doing automatically, it's okay. Children with ODD are used to adults and parents be angry at them, be frustrated and annoyed with them all the time. So you want to give your child the opposite reaction and focus on giving your attention when things are going well. So they don't seek out that attention for when they're doing negative things. Because if they're not getting the attention for positive things, they will seek it out for negative things. We don't want that. Tip number 4 for helping kids with ODD, model the behavior that you want to see. Kids don't know what they don't know. So many times parents just tell kids, no, don't do that. But then they don't tell the child what they should be doing. It's not natural for kids to automatically understand the better behavior. Kids need to know what that is. So parents have to show children what they want from them. It's so important to replace that bad behavior with what you need them to do. Instead of leaving the child hanging with, okay, well, I know what I can't do, but now what? So replace the bad behavior with something new. Show them what you want. Tip number 5 for helping children with oppositional defiant disorder is avoid power struggles. This is going to be really tough, but you have to pick your battles and be selective with your boundaries. Tip number 6, create a routine and provide consistency in your child's life. This means providing consistency with rules, expectations, and consequences for their actions. These things like rules, expectations, and consequences should be discussed when the child is in a good mood and set as the standard when things are going well. Set limits and consequences for actions before they are in trouble. This is important. Tip number 7 for helping kids with oppositional defiant disorder is connection. Connection is important. These kids need more love and attention than you realize. They already have plenty of adults angry and frustrated with them. Tip number 8, make sure every adult in the kid's life is on the same page. This goes back to creating consistency. Behaviors and expectations should be universal. Collaborate with your teachers, the coaches, the counselors, and anyone else who might be in the child's life to create a consistent standard of expected behavior. Tip number 9 for kids helping kids with oppositional defiant disorder is set your child up for success on purpose. This might be giving them a chore to do around the house that really doesn't matter if it gets done or not, but it's still important for the household to have it done. Then, when the child completes their chore, you now have the opportunity to praise them and focus on the positive. And tip number 10 for helping kids with oppositional defiant disorder is actually to take care of yourself. These are not easy children to parent, and your self-care should be just as much of a priority. If you're tired, then your patience is going to be shorter and your mood is going to be more irritable. You need to take care of yourself to take care of your child. Make sure that you're sleeping, that you're socializing with some friends, that you're eating well. I also suggest joining a parenting support group to help you vent in a safe place and get ideas from others that work in other people's homes so that maybe you could try those out, or just know what doesn't work for others so that you can avoid things. I hope that was helpful today. My last piece of advice for parents of children with ODD is to expect that their child's behavior to worsen before it gets better. These children will likely reject any change they see in you, even if the change is positive for them. They will test your patience and push your buttons just to see if that change that you're trying to create is really intentional and if you really mean it. But now that you know that, the behaviors that they're going to worsen before they get better, you can anticipate that roller coaster and prepare yourself for the ride. If you have a question that you would like to submit for next week, please do submit your questions or DM me. My email again is theimpactfulparent@gmail.com. Plus, if you want to become a more impactful parent, check out all that my website has to offer. I have parenting courses, family coaching, a free downloadable app that's like having me in your pocket, and so many free resources. But until next time, you got this, parents. I'm just here to help.